The debate has been the fact that we do not have health workers in our various health facilities, but we are exporting, health workers. That is not it. The availability of health professionals in this country is not a problem.
Ghana bayo Tom yedi amanfo akọ ahefa Antigua and Barbuda na just na sefuyi na eno no eyo mo mutifie na na so mo yedi because we let lie me se me yedi ma dada Ghana condition we na so odi bi kwa brochira me protest me demonstrate rough there's 130 nurses yaso mo e de mo kọ akopem mo Antigua and Barbuda na enye honko a enche Kaise Grenada almost ya sign agreement to her ya dey amount for be call Germany skill workers ya dey amount for be call na na ya to mu say a teacher for ni nurse for ni na ya dey make Barbados and Bahamas and you say no Ghana for ya dey o metu kwan upe o be call na Ghana ni be kwan na mpa kwantu me say wo the ship be si ha wo the airplane be si ha say Ghana obi anko in fact e be starting from president we go see ayayin so omukura be di kan ya man say na ye kwanya position yenya sitie ni na yenya kwa ebetu enti wenu mi hu health minister honorable kwamna minta kando me pacho eyo mo service num dada ana mo de omo ko se bia room e ba beda ho for omo akire no ana omo akire na omo yenya adwuma nye no omo na straight mo do omo kwa pemu ewo Antigua and Barbuda na
For the government of Antigua and Barbuda, the decision to recruit nurses from Ghana is a necessary intervention to address persistent staffing shortages in the country's healthcare system. 43-year-old Achia Menu is among the 130 health professionals on this exchange program. For her, this opportunity means the world, coming after several failed attempts to work overseas.
To be frank, I love the beach, even though I don't know how to swim. A lot of beaches, 360 beaches, and then their carnival is perfect. The road, amenities, all nicely. And then we are not paying for tax. The money is also good. They are going to give us transportation, free food, free accommodation.
Although she previously had the opportunity to work briefly in Saudi Arabia, she says the experience cannot be compared to what Antigua and Barbuda offers. Still, she believes there's a lot Ghana can learn.
If I'm sick, why should I pay for it? I'm not happy with it at all. And I was working in the theater. When you go to the theater, you don't get a chance of going outside to buy food. And giving us food is another wahala. They don't provide food. But other places where I went to Saudi before, they were giving us food 3 times a day.
Under the arrangement, all 130 professionals are on secondment, meaning their jobs in Ghana are secured and they can return home at any time.
My colleagues out there, don't be in a haste, don't be worried. It is always a queue, and definitely it will get to your turn.
While Ghana may be exporting labor to support other economies, the sector minister, Kwabena Kando, insists the issue is not about availability, as the country has more than enough health workers. Inheriting a backlog of over 80,000 trained nurses, the sector minister explains that limited resources, not numbers, are responsible for the high unemployment rate.
The debate has been the fact that we do not have health workers in our various health facilities, but we are exporting, health workers. That is not it. The availability of health professionals in this country is not a problem.
As an experienced one, and I hope that when you're in this one, appointment too. Nurse for na mudo moko monfa omo metima akọ Ghana ye dini ye they go and be professionals enye omo a omo te wa TikTok no ma hwa obeba no yare ni da ho na ohwe TikTok mama mfa san gofo di bi nko o ngogu enima se ho na na efekeke ohwe health minister honorable Kwame Minta Kwabena Minta Kando one chief chief of staff Julius Debra na there is a umienu omugina no mo hwem mungo ate mungo enjoy na sa baba we dey catch wa the chen baba bi e wo yase the only baba me mpe baba say utukwa free sunya ha kwakra I don't know why say ade nguko be bia nya wo ba fo sika bia ma we mitimi $0 hwimfa so bia ni so nje no kwa ya ana baba say odi hye bia free mu na okọ pa na sa baba say odi hye kwa brochi okokura na I said, "Wa betre wo kumom." Kwana want to know. I said, "Nyankopon atam hu e na betre wo kumom." Sa edu sa atam na wo do no che wo na mfo bia, wo do che wo di hye bia. Okwa brochi o chaman. Anya mami, musumi de na say nkoye kura o. Mati de me send $100 bia mama. Wo say da ho ba ho so. Ye ka wabre ba hu sika na ofi maba. Sa na tie. Enti emranta ni mayayi anasifu yi. Yaso mo dese na minim Ghana no as a favor ni na no come anasifu nkwa. Omo nkwa na omo efe ne say alawa omo de mu edu teacher fu yi. Uwi a omo nkwa na timi ka say uniform allowance. Eno nkwa nti omeko strike ma manfu awu. Yentimi nka hwenkyere omo. Omo aso na go do hospital wa kalabule omo bu yi. Yentimi nka hwenkyere omo. Mimu ade honhom. In fact, ya tunu free asoro dan mu no. Ekopie mu hospital na eba no ahu patients na nkure omu. Anese fonko a na ekoche omu. Ene ema no de ndie kra de na edutwam. Emema nim kro no bo. Ema nim kro no bo na de ene amato. Ane hantan. O kasa ne ho ase kasa dua ho. O kasa ho ase de onye ne ba. O tiaw ase de ne frustration una de man no ozo nya president. Zango vo bi na mo de ko de be hayi. Ba se mo de omo ye adwuma pa na ekoso anso mo de omo ko na ya bre wa ha na ase de. Ase me de dai si pa o. Na nya asempa na nya asempa na nya mammo tantan. Ene ya mampanifo born na ye hye bi pa o. Omanga na mu ha. Endi ka tere me se oman ya gold abu muso koko abu muso diamond ne ho bauxite ho lithium be sa nema we ni na akoda no bofo kasa keke foso bi ani so de magana fo and for so ba ku say any so de maye and a country that lack hospitals, a country that lack hospital with beds, a country that is still struggling to have a patient per nurse ratio in inefficiency no sa country ko na say so man for say a nurse fu e mu nkonko ye adwuma all because IMF mubu mane tantan na mu de ko IMF ya na IMF na ono so obebo ye no no say mia ye hwe mia IMF ni mia ye look at how IMF panese ye Ghana near ko school awie from nursery ana na man for start na we ko KG primary 1 ko 6 wabeto us from JSS1 to JSS3 omo obeko from SS1 to SS3 wabe ko university 4 years nursing training for friends 3 years na we na yes IMF amammo bi boni nti yentimi mfa workers and started free jomama so jomama na di kan ko IMF ana nanado beto aso ya mfa workers ya start say for workers anom gas na mudi ye na yeso emedibi anom so mayiru madu krasa che NDC fo no anom so ko IMF and every government be obi make sure say obewie no obewie wo IMF na work nipa say ye for mu adwuma mu no o man stranded and from 2021 Ghana nurses and midwifery for kura na so still am for that so kondo minim aya say mo cha tare na ya mu fa na say na de mu ko mu nya adwuma na sire na amon for guso na protocol obitimi twa 20,000 Ghana cedis open nursing school ngwako owie say ko twa school fees abodin ube so from 2021 and 2026 how many years ni na daso dem and look at the budget say guru abodin na government men bit ma fa mu ina bom wa we 2026 dem ma dem no fa due ni amani hunu o be che wo feel rough na eno na we mo am ko 130 pe sa countries na ni o ma ko bebrebe ni na o mu ntimi fa dodo yes as it stands now you were about 74,000 nurses egufie ene minimum bi am start ye makeups ebi ye a friend is hairdressing ebi ye a friend is fashion design and ebi so de ba si bra no mo de aye na anu ya ga bi kan asem na me wura kra ho o se na mayere mi ho ko school ye wie a abema ma adwuma no na se bebe maduri ene mema so ma bam so ma wai se ba ni nya adwuma mo mpe me se na okay tetire na ye se bema nkwa na ye adwuma hwe ma ne mo se ye kwa mo ko bi ne ye kwa mo ko bi se de kakraba na nkam so ne kakraba na nka fi aye de o se ene so na makwa ba mi nya adwuma yi enti mi nya bema bi e wo sika o mo so dodo na no ida se wa settle awie o ne yire bi awie ana wadi kan tu so oba o ne betra enti wo no o pe abetwi moko anopa wie na de ma no no abenkwan no ahonkate nkwan fa se fridge ma no opefufu ahomache so de wo ma no so ompew ma mema mo so de ni aitan yo ube ko so na de oso ope no onye o onye baagu sei na so no na te no nti na si se nti dia ya se midwam na majisika na manya bi edi go me tin ko kan chen ma me se after enfie bebrebe odi mi ko school no on se ma me sika ngo didi o se nya fere fere na ye man panifo so na agba aburo si yai but according to your health minister Kwabena Minta Akando say ome make sure say ya nurse for ya omukoi omedi omuhuni no ma protect the image of Ghana at the same time say in case say wo akoduru honom no say unfili okay I want edewa na wo do pa na ntipa na wo ba dia medonyame so beba no wo busuafo be crusade edi wa she 3 months no mbusu ye fast dem press dem wo you okay wo ko so vie hia wo go ya say wonti masaba minima kwa ba ku be go ya wasa wonti wasaba e efi na busuafo ko hwe nanim wo fire hiafuo fie se godu ya say awo wonti masaba nonsense na hanum awo bre ma e ma ye ntim ye ti go sasa bro etim eti almost say ugodu na ompe a uba Ghana waduma ye safe and sound e ho na mu say uboa enye omo fie ne yafo omo service ne mu dada.
Ghana Labour Exchange Program is one of the interventions by His Excellency John Dramani Mahama, President of the Republic of Ghana, to create more jobs for the good people of this country. And today is the turn of the health workers. As you all know, we inherited a backlog of more than 80,000 health professionals who have completed various degrees and yet are at home and do not have jobs. So as part of government's intervention to create jobs for especially the health professionals, we are exploring avenues where countries have requested our health professionals to work with them. Today is about Antigua. We are working on Jamaica, Barbados, and Trinidad. And so we'll be doing that in batches. And so today we are here to say goodbye to you, but we'll be following your progress with keen interest. And as you are going, you must be minded of the fact that you are carrying the flag of Ghana. And therefore, we wish that you go and work with diligence and professionalism. Those of you who are at home watching us, I'm very hopeful that it will get to your turn. Usually, the debate has been the fact that we do not have health workers in our various health facilities, but we are exporting, health workers. That is not it. The availability of health professionals in this country is not a problem. As I have already indicated, we have excess. We have inherited about 80,000 health professionals. But as you all know, we have a country to govern, and at every point in time, our budget can absorb a certain proportion of them. And so as government is looking at absorbing some internally in-country in our various health facilities, we are also exploring other avenues outside the country. I thank you for the opportunity.
It helps me that say, hey, uko na unye okay asabra back. Ghana, waduma na dasu da safe and sound. I'm say na me ka se mu pushi we mako. Na mu de omo mo fie na be chem. Na omaduma dasu da ho no, na je se mu betima fa bi account da na mo fa bi. Eh, mu be hwe you. Aha. Mu be hwe you. A man for month mean to fie after so long days in schools. En wie man kan tell me say we no kwa wie na say anye ya. Asa anye ya ka ho, anye ya to aso. Mo bia ma mo fa mo ofie ni nchem bi mo ofie no mo cha se enrole bi wom na ya bre o ma tena fie ache align science for the I must say align health 2019 o mo kwa de adu twem eh boye enti anase fo mo ko mo se yesi mo ko comport mo na emom na amfa mo mra na contract na mo sign 3 years but omo option to renew and the 3 years no so wie na say Antigua and Barbuda for no say, oh, you have worked diligently. Waduma no so ani e pure, clean, and ye betima ma kwan amos ato aso bio as nurse ni awo Antigua and Barbuda. Na ho anowie no to say, we ye nurse ni na say o de nka we ho a enkofa time bia ncha se nkobodua na wo de ba Grenada enche Ghana for bi be ko ho Barbados yede anurse for ni achicha for eso ebeko ho ansa na Bahamas eno so ye de nurse for ebekọ ho ndi sa countries we ni na Germany ye de nurse for eso bekọ ho ti nurse for no de momudodo na no Ghana ban aye na dwen say akwantu obamotu apart from that ka say Dubai Germany ye de Ghana and Saudi Arabia and Qatar ya sign contractor ye de skilled workers ekos countries we ni na so am say hey cha muguso am cha manfu yi me sure say e dey party for fa enya fa mpom do so me 80%. Muguso am so mo make sure say enya ye best workers na mo so mo koyi ko 24 hour economy mo so mo start mo be start ya mo so ye ni na dia kwa gogu hoyi ye man ye bebu ni ye de ye benya workers am mo ye adwuma wa ha de ayo say unemployment association for no ndi to de dia ye ma ba your side na ye so ya mo bi hey e man Ghana owi a obi so man kronkron na kronkron be na we Ghana we mu o man we no Ghana we na da ho no kronkron bi sa shem ya say no poto but as a hope kakra as I say ba and we hope and pray say for God and country nti the health minister honorable Kwabena Minta Kando one John Dramani Mahama one ni friends chief of staff Julius Debra omeboa masa policies here omodi bai abefa amagana for Nigeria so because at the end of the day say wa hwe oba school na wa wie na oda so didi wo we friends o conference mu de ja rough na ma mi gro betima bo ne badue wo ye oba akra de mo consider kakra na go ebe ma shake na me ss na ma mi shase bu mani je wo da so difi oba na o shede ma na hwe na hisa senior high school na wa go university nursing training wa bo ka enti sa na wo da so difi o senior aduma ebe ye ne yard off enti Ghana for Eriko Antigua and Barbuda na enye no nkwa other countries will follow nti anase fo amutifie mungusu bo mompaye na ente sama anko honoma bo benya adwuma Ghana because omam wa ebekọ omama be shem for comment comment section na see we are subscribe like na share mo nua enya bi hwe edi no eye ba ko pe Maxi Billian awo naked truth Oldboga trends macro bye bye.